was at work. I'm an urgent care nurse, and I was tending to a patient when I suddenly had this squeezing in my chest. And being a nurse, the first thing you do is you just deny it. But it lasted for probably a good 30, 45 seconds, so I had the nurse practitioner do an EKG on me, and it was completely normal. Went back to work, just didn't feel myself. Texted a good friend of mine who's a cardiologist here in San Antonio. He told me to stop fooling around and go straight to his office.
Joe went directly to his cardiologist, who, instead of putting him through a lot of ancillary tests prior to finding the diagnosis, listened to him, heard his history, and took him straight to the cath lab, where they found he had significant blockage of his heart arteries. When he got to this point, he didn't feel that he'd be best served by just performing stents or any non-invasive therapy. He thought, because of his age and his family history and the disease he had, that he'd be better served long-term with an operation. That's when I got called.
The cardiologist went out and spoke with my wife, and he told her, there's nothing I can do for him. This is beyond what I thought it was. I had multiple occlusions, and I was pretty much 99% occluded around my heart. So he had to make an emergent call, and Dr. Rodriguez came in pretty much to save the day just at the last minute and performed open heart surgery.
We bypassed 4 of his arteries. He didn't have any long-term damage to his heart. Having looked at it, there was no big scars or big areas of infarction. So I think he's going to have a good long-term outcome.
It's been 3 months now since the surgery, and it's just now that I'm feeling normal again. But I'm very grateful, because there would be no life if it weren't for the surgery that was performed.